Today we are going to perform a Brazilian butt lift on this woman. We are going to harvest fat from her abdomen and her waist on both sides, as well as her broad back rolls. She's had previous tummy tuck and breast reduction in the past, and once we harvest the fat, it'll be captured in this container, and we will then treat the fat and then inject it into the buttocks. So we've just infused tumescent fluid into the patient in the areas that we're going to treat, which includes the abdomen, waist, and broad back rolls. And we're going to start liposuction. I usually pre-tunnel with the cannula to open up the pockets, thinking that it's like Swiss cheese and you want to make the holes in the cheese layer to get to the appropriate level so that you can harvest the fat. And we will start the liposuction now. So I'm pre-tunneling, going through the different areas, and then I will put on the liposuction and perform the procedure. Part of the liposuction, we did liposuction of the abdomen and part of the waist on each side. We're going to turn her side to side to do the rest. Here is fat that is now sitting here. We've also siphoned off a number of syringes to let the fat wick off to separate from the liquid, and we'll drain that liquid off and use that to inject in the buttocks, and we'll use this plus what we take off from the back and the waist to complete the Brazilian butt lift. Okay, so we finally completed all the fat harvesting. We have 500 cc's in syringes right here, and we have almost 1,800 cc's more here if we need it. And we're going to inject fat through a few sites from up here and maybe from the sides to fill out the buttock, as well as to fill out the lateral hip area, which is very deflated on both sides. She has asymmetry. We'll try to correct that a little bit to adjust for differences in her anatomy. So we just completed the procedure. I injected over 950 cc's on each side of the buttock, filled out the lateral hip area, as well as the lateral buttock area and part of the central buttock area, which is what her most concerns were, really here and here. And we put over 950 on each side. And this is the end of the procedure. The patient will go home in a garment and come back in a week for follow-up to take the little stitches out where I made access incisions for the liposuction as well as the fat injection.